The FDA gives full approval now to the Pfizer COVID-19 vaccine. San Diego County Supervisor Nathan Fletcher joining us now with the latest on that. Nathan, good morning.
Good morning, Raul.
Big news, obviously, from yesterday. Now that the vaccine is approved, do you believe, as the president believes, that more people will get that shot?
Well, it's not going to hurt. I think it's definitely going to help. I mean, the number of folks who use that as the reason that they didn't want to get vaccinated certainly should do it. I think it paves the way for U.S. military employers, other types of folks to put in place more requirements or mandates or consequences if you don't get the shot. So it definitely helps. I think it's a step in the right direction. It shows what we've known. This vaccine is safe. It is effective. And in San Diego County, we're providing it free at locations all over our region. So there's no excuse not to get your shot.
You mentioned the mandates because it is approved. What are your feelings specifically on whether or not you're going to see more and more companies, more and more people putting in that mandate to get the shot because it's now fully approved?
Well, I hope they do. I mean, it was a week ago at the county. We came out and recommended that all employers do some form of what San Diego County has done. And, Raul, it's important that you do have freedom of choice. No one is going to grab you and hold you down and force inject you. But the freedom of choice does not take away the freedom of responsibility or consequences for that choice. And so when you don't get vaccinated, you are making a decision that impacts others. It's not a decision that just impacts you. You look at the rising hospitalizations, you look at the strain on our hospital system today, when 99% of those hospitalizations are in the unvaccinated, that choice you're making has an impact on others. So there are consequences. Now, I think they're very mild consequences. For county employees, if you don't get vaccinated, then you have to get tested weekly and wear a mask. That's it. And so, I think now in the U.S. military, my son's a Marine, it may be very different, right? Because they travel in ships, they go together, they're simply not going to tolerate it. So, I think what employers choose to do, everyone will have a choice if they want to get vaccinated. But there could be consequences for that choice.
You shared that post from a friend who basically told people, quote, who researched it. In other words, do you think that was too harsh? Because there are people, we all have people. Here's the Facebook article. Here's the other article. Here's the article from Australia of children getting herded into a stadium and forced. A lot of those are just simply not true.
It's simply not true, Raul. And look, it's very frustrating when you sit there, in these meetings for 7 hours, and people aren't coming down and saying, you know what? Look, I read the 7 peer-reviewed scientific studies. I get the mask works. That's why maybe doctors have worn them for 200 years in surgery. But this is America, and you can't make me cover up my face. And sometimes the price of liberty means people have to die. Well, if you said that, you would be honest. I would think you're selfish, but you would at least be honest. But Raul, they come down and they said, I did my own research. One of the leaders of one of the organizations that turns all these folks out came down and made the case, because she's done her own research, that you ought to take horse medicine. The federal government had to put out a warning that says humans are not horses. There is a challenge of horse owners that can't get deworming medicine because someone on Facebook is convincing people that they did their own research and you ought to take horse deworming medicine and put it in your body. Now imagine, Raul, a situation where people won't listen to 99% of doctors, FDA, CDC, and look at the data. If 99% of COVID hospitalizations are in the unvaccinated, I mean, I may not be the smartest guy, but that's kind of an indicator to me. And so at some point, we got to get people to quit taking horse deworming medicine because they listened to someone on Facebook who said they did their own research. And let's actually listen to researchers, and let's actually listen to science, and let's actually trust our doctors. So I stand by it unequivocally.
I wanted to, before we let you go, get your thoughts on the fact that President Trump was booed for only a second in Alabama when he told that crowd to get their vaccines.
I'll never understand, Raul, as long as I live. I understand why. I'm a Democrat. There's Republicans. We have differences of opinions, different values, different things we hold. How in the world did listening to your pediatrician become a partisan thing? I mean, I just don't understand it. It just makes no sense. And then the folks that are hurting are themselves.
Yeah.
So it's just the weirdest thing. But please, for the love of God, just don't listen to your cousin on Facebook. If you want to listen to someone who did their own research, listen to a researcher, someone who does research for a living, and just get the shot. It could save your life. And if you don't want to tell your friends on Facebook you got vaccinated, then don't tell your friends on Facebook. But go get the vaccine, because we know it works.
I sense your frustration, I do. And we used to make jokes about your crazy uncle sending you things on Facebook, and now it's really come around to just the lack of correct information that a lot of people are getting. Nathan Fletcher, we thank you for the time. As always, appreciate it.
Thank you, Raul.